Electrolyte imbalances are a problem. A 2013 study looked into 996 patients over the age of 18 who went to the emergency room for symptoms such as fever, vomiting, or abdominal pain. Of those 996 patients, 884 of them were admitted due to sodium or potassium imbalances. Electrolyte imbalances are often a symptom of other diseases, such as cerebrovascular disease, coronary artery disease, and chronic renal failure. Currently, the gold standard for measuring electrolyte imbalances involves drawing blood and waiting for a lab test to yield results. This is impractical and expensive for people to monitor their levels frequently. Introducing the Sweatometer. The Sweatometer is a medical device that analyzes potassium levels in sweat, alerting the user if there is an electrolyte imbalance, and is done without the need of a blood sample. The device is primarily focused on measuring potassium and pH levels non-invasively of patients who are at risk for diabetic ketoacidosis. The unit is sleek, compact, and easy to use. Its clear acrylic walls house two main sensors, a potassium sensor and a pH sensor. Here is how to use it. First, we have a diabetic patient who may be unaware of their electrolyte imbalances. The operator makes sure to wear gloves. The operator measures the mass of the cotton pad before and enters it into the LabVIEW software. Sweat is collected using the sweat collector band provided. The patient must do some brief exercises to induce sweat. The mass of the cotton pad is weighed after and placed into the collection chamber. The operator runs the program based on the situation, which calculates the amount of solvent needed to be added to the test. The operator adds the calculated amount of solvent. Allow for solution to equilibrate. Pull a plug to allow flow into mixing chamber and testing chamber. The sensors are moved to the testing chamber. Conduct test and collect data. Save as patient data.
This is wrist. Actually should be in documents, review data, natural muso, and we can see.
And that's it.
Our Sweatometer device is compact, can be easily moved from one room to another, and can be used in various settings to non-invasively monitor the patient's potassium levels.
I would say perhaps the biggest advantage to the Sweatometer is how easily it can be cleaned. With both a solution, acrylic can be disinfected quite well, which I think is a huge benefit to our project, considering even we're measuring things on such a small level that the slightest of contaminations could throw off our values. And so having something that we can make sure is standardized on a baseline every single time is a huge advantage for our technology.